Welcome back to SWGA Sickle Cell Awareness with Patient Advocate Monica. If you're visiting for the first time, welcome. If you are a new subscriber, welcome to the tribe. In today's video, I will be talking about how it has been scientifically proven that distractions reduce pain. The next thing that I'll be talking about is why medical professionals don't apply this to sickle cell patients. And the last thing that I'll be talking about is the top 3 distractions that I use to reduce pain. Let's get into the video. According to the Nursing Times, mental distractions can really reduce pain, and the effect is not just in the mind, research has shown. The results demonstrate that this phenomenon is not just a psychological phenomenon, but an active neuronal mechanism reducing the amount of pain signals ascending from the spinal cord to higher order brain regions, said study leader Dr. Christian Springer from the University of Medical Center Hamburg in Germany. For the full article, I will put that in the description below. So it has been scientifically proven that distractions do reduce pain. It's amazing when you go to the emergency room or you go to your doctor's office as an emergency visit or you do a walk-in and you're there, you're in pain, you're not feeling well, you're not feeling the best, and the pain is unreal. Like right now, it is 37 degrees outside. Cold weather and sickle cell just does not go together. So you're feeling this chronic pain all over your body. You've taken medicine, but that's not working. So you go to the emergency room, or sometimes I'll go to my primary care physician. It's like, I'm doing a walk-in today. I don't feel well. I'm in a lot of pain. I need for him to do something. And for a minute, once I sign in and check in and everything, and I'm sitting there and I'm in pain, and I'm trying to take my mind off of the pain. I'm really trying. So I'll get my phone, or I'll get a phone call. A friend might call me. It's a couple of friends that when they call, I bust out laugh just to see their number on the dial, just because they're just that funny. They're hilarious because I know they're gonna say something crazy to make me laugh. So I might be laughing about that, or I might be having a conversation with my mom and we laughing about something that's going on in the family or going on TV or something we've seen. And I remember sitting out there in the waiting room and they was just taking their time. It's like there are not other patients here, so I'm not for sure why I'm waiting. And I remember once they finally called me to the back and they got my vital signs and everything, and I went to my room. They assigned me to a room, and again, I'm sitting there a while. So, and the pain is getting worse because it's not only cold outside, it's cold in the doctor's office. And it's like, I need something just to reduce the pain. And I remember sitting in the room a couple of times, and I remember my nurses outside saying, well, she can't be that sick. She was out there laughing. And I'm thinking, but I'm in pain. I didn't come here just to come in here. I'm coming here because I'm in pain, because I just don't show up just to show up. If I'm going to a doctor's office, I'm going to the emergency room, it's something seriously wrong. And I remember her telling another nurse, she was like, well, she laughing, so I don't think she's in pain. I just really don't think she's in pain. So I was sitting there and I looked at my mom. I said, Mom, did you just hear that? She said, yeah. Yeah, I heard what she said. So she checked my vitals and she checked my signs, and one of the things was my blood pressure had dropped extremely low. That was part of me being in crisis. My blood pressure had dropped low. I was cold. I was achy. It was a lot going on. I was just in a crisis. And it's interesting that in nursing school, they're taught that people use distractions to reduce pain. It doesn't get rid of pain, but it does reduce pain. And I'm just disgusted that they forget that once they start working with patients for real. And it's interesting that is other patients, they believe that they're sick, other cancer patients that they're sick. But if a sickle cell patient comes there with a loved one or their caregiver, and they may be laughing at something, and that caregiver, like sometimes my mama make me laugh just because she's mom and she don't want to see her child in pain. But I've heard this story from numerous other patients that have went to the emergency room or they went to the doctor's office, and their roommate were with them or their friends were with them, and their friend was trying to keep them in a good spirits or in a better place. Because my friends, they do that for me as well. And it was like they waited so long in the emergency room, so the nurses were thinking they could wait a little bit longer because they felt like they were feeling better because they were laughing. But I think they forget that it has been scientifically proven that distractions reduce pain. It doesn't get rid of pain. So if you learned something from this video, make sure you give this video a thumbs up. Share this video on social media. If you have not already, make sure you subscribe. Hit the notification bell for weekly uploads. So every time I upload, you'll get that notification that I have uploaded. Now, let's get into my top 3 distractions that I use when I'm in pain and it's just to reduce the pain. It doesn't get rid of the pain. I love to travel. Travel is my therapy. So one of the things that I do like to do is go onto my YouTube channel, and you'll see that I have a travel therapy playlist. And I love to sit and watch some of my videos like this one. I love the beach video. When I was in California, it just relaxes me. It just reduces the pain for me. And my mind kind of put me on the beach. So until I get some medication to relieve me, I'll just watch those videos and it relaxes me. It kind of gets me in a mood until they do something about it. The second thing that I do to reduce pain is I listen to morning Metta. Travis Spencer has a YouTube channel where he do morning Metta Monday through Friday. And of course, my favorite one is the one that he do on Thursday, which is music therapy. I love that he plays the I Am video. I love that. That video and his channel will be in the description below. And the third thing that I love to watch and laugh at is Katt Williams. That doggone Katt Williams, I love watching him. I watch him on YouTube. I watch him on Netflix. I watch him on Hulu. I watch him on regular TV. And I really love that he did the Pimp Chronicle series. I watched that, and then he did his American tour. So I did watch that, and that helped me out a lot. That helped me out a lot. I just love Katt Williams. And then I love when he came here. I just hate we couldn't record it. And I think I did record it, but I can't find the recording. I did a voice record of him because I had a dumb phone back then. I didn't have a great phone. And when I was in a lot of pain, I would just listen to Katt Williams. And I love when he talk about Tramadol and Percocet. Percocet and Tramadol. I love me some Katt Williams. He's to me, he's like one of the greatest comedians of all time, and I love to see him interview. I love Katt Williams. He has helped me with a lot. I love watching him, and he reduces the pain. Those are my top 3 distractions that I use. There are more. There are a lot more, but those are the top 3 that I use. In the comments section, let me know what distractions that you use to reduce pain. Not get rid of pain, but just to reduce pain. Until next time, stay hydrated and stay well. Goodbye.